Dr. A.J. Tarpoff, our department's extension beef veterinarian, is going to touch on a very interesting topic, and practical euthanasia for cattle. So Dr. Tarpoff.
Thank you, Dale. And thank you, Dr. Pugh. That was pretty entertaining. So yeah, I was tasked to come up with a topic for this year's field day, and it's a topic that we don't discuss very often, and I think we should, because it is one area that hasn't been emphasized as much, but for an animal welfare and well-being aspect, it's at the number one of the list. And before I get into this discussion, I do want to be up front. When I was working in Canada, they actually have a beef code of practice. And the packers in Canada, which are the same packers that we have in the United States, wanted a third-party auditable welfare audit to be able to have packers send people to a feedlot to measure animal welfare. Do you know what the only two ways that you could fail one of those audits were? One, an inappropriate euthanasia, a failed euthanasia done inappropriately, or an egregious act of neglect or abuse, okay? And at that point in time, it really hit home with me how important it is, okay? I came from the beef packing industry, my family did, and who has experience with the packers, large packers, okay? Well, guess what? If they have a failed euthanasia and a failed knocking to knock those animals to unconsciousness, they get shut down. One. If they fail one knock in the knock box, they get shut down until they fix it, okay? So I want to start with that. And euthanasia, okay? It's humanely ending that animal's life. And even our American Veterinary Medical Association regards this, okay? It's as unpleasant as it is our moral responsibility to take care of those animals and do what's best for them, even if some of those cases means we need to put them out of their suffering, okay? We need to put them out and make sure that they don't have to undergo undue suffering. That's our moral responsibility as cattle, okay, to take care of these animals as best as we can, and this is a part of it, okay? But it's not an easy thing to talk about. So again, euthanasia, humane termination of an animal's life. We're dealing with livestock. So what kind of products, what kind of usage we have available to us to be able to appropriately euthanize these animals? Number one, firearms. Okay, firearms are number one. There are also some captive bolts that we'll be discussing. I'm going to be talking about caliber choices. I'm going to be talking about captive bolts. There are some euthanasia injectable drugs that are for veterinary use only, but we're pretty restricted on how we can use those products because we may not be able to dispose of those carcasses after we use those. Very different from cats and dogs and everything else. So we do have to keep these things in mind, and that's what we're going to talk about. If you go back to the actual meaning of euthanasia, it's a good death, right? And that's what we're after. How do we give these to our animals or our livestock that did not recover from a specific disease, that has a painful condition that won't recover? It comes down to these. We need to make sure that we perform this in a timely manner, which I'll talk about. The method should minimize pain, distress, and anxiety of that animal prior to the loss of consciousness. Basically, we don't get them all amped up and run them around before we actually have to have that animal lose unconsciousness. It needs to be sudden, needs to be quick, needs to be performed correctly. That should be our goal. So, animal selection. This is what the discussion always leads to. Okay, whether it's with a feedlot, a growing operation, what necessitates, what gives the necessity of euthanasia over an animal that we're going to continue to try to keep to recover. Okay, and I'm going to go through some of these good guidelines and things to consider. Number one, a severely injured animal. Okay, has anybody ever been involved with a livestock rollover? A couple of you? Okay, that's an extreme situation. All right, not a good situation to be in. That euthanasia, of course, is at the top of the list. Okay, severely injured animals, broken legs, broken jaws, injuries that we know those animals will not recover from. Our decision's already made. Okay, I think where we need a little bit more direction is some of these animals that we have already been in treatment. They have been in therapy. They have been under veterinary care. When is our stopping point? I think is a more important piece that we need to discuss. Okay? Has anybody in this room ever had pneumonia? Several of you raise your hand. Is pneumonia a painful condition? Not really. Most people I talk to say pneumonia wasn't very fun and it was painful. Yeah, but chronic pneumonia in animals is a very painful condition. The attachments to the inside of the lungs, that is a painful condition, and those animals are in pain, okay? So chronic, severe, debilitating pain and distress from a chronic disease. This comes down to chronic pneumonia, chronic arthritis, septic feet, things of that nature that don't have really any chance of recovery. Those are the animals we're talking about, okay? Continuous weight loss. That's one thing that we always have visual assessment on is this animal's been treated for pneumonia. We've stopped treatment. We're trying to let that animal rest and recover, maybe in a recovery railer pen. We can monitor those animals, and their body condition tells us a lot of how they're recovering. If they're continually losing weight, then our decision is made, okay? Non-ambulatory, downers, okay, downer animals. If they've been non-responsive, if they're down for more than 24 hours and not making any progress to recovery, that's an animal eligible for euthanasia, okay? So again, just to outline this, the decision making, pain and distress, likelihood of recovery. Likelihood of recovery is where you're working with your local veterinarian, okay? Your attending veterinarian will help walk you through what the likelihood of recovery is on a lot of these disease issues. Ability to get feed and water, okay? If you have a downer animal, you got a down cow out in the pasture, how much water do you think she drinks on a daily basis that she needs that we actually have to supply her if she can't move to a water source? We're pushing 28, 30 gallons, right? Okay, so the added labor, the added costs, just to be able to get the needs to that animal is pretty important to consider. Medications and withdrawal times. Unfortunately, sometimes that plays into a key factor. Okay, if we have too long of a withdrawal period that animal cannot enter the human food chain for whatever reason, that's another indication that euthanasia is warranted. Okay, economics, which we can get into that a little bit, but condemnation potential. What do we do with chronic animals, or what is our goal with chronic animals to be able to get them into the food supply, right? Get them rested and recovered. We have railer sales, things of that nature, to be able to salvage some type of value from that animal to be able to be fit for human consumption. But guess what? A bunch of those animals may not make it into human consumption, okay? The condemnation potential, especially on arthritises and active pneumonia, making sure that we monitor for body temperature before we sell those animals, okay? Or the old arthritis, if they've got more than one joint on more than one leg, they're going to be condemned at slaughter. Maybe something to keep in your back pocket, right? So what does that look like? I don't want to talk too much about this, but continual weight loss, animals that are down, regardless of what that is, a week too early is way better than a day too late. Because a day too late, that's an animal welfare problem, okay? And it is our moral responsibility as caretakers of these animals to make sure it never becomes an animal welfare problem. And we are here to end that animal suffering, but always keep in your back pocket. I know a lot of folks that refuse to euthanize any of their animals just because they're so connected with them. But just having to euthanize an animal does not equal failure, okay? We didn't fail that animal. We are actually doing our level best to take care of it, okay? There are unforeseen circumstances that happen to these animals that, unfortunately, there is no winning, quote unquote, okay? But we do need to manage that situation appropriately. So talk about it, and really what I wanted to talk about was the different methods, making sure that we're doing it appropriately and what do we have available. And here's what I'll talk about, what we have available for proper euthanasia of cattle, okay? And we've got firearms, captive bolts, and injectable. Whatever you use, there are some other considerations to keep in mind, okay? Human safety. Every time with firearm euthanasia, guess what? We are firing a projectile at a high velocity. Is there a risk to that? Risk of ricochet. Possibility of hitting another animal in the area. Where are all our employees? Do we know exactly what is behind that animal? We'll talk about that a little bit. Welfare, restraint, practicality. Practicality is a huge one. In order to use a captive bolt, you have to have that animal completely head restrained to be able to utilize it. So a captive bolt is not very useful for a mobile animal that may be trying to run you down, okay? So practicality is really what comes into using these different products. Skill, cost, aesthetics. Sometimes aesthetics plays a key role, okay? And then, of course, carcass disposal. So let's talk about firearms. Don't tell Beto I'm here talking about firearms, but we are going to talk about firearms because it is the most common means of proper euthanasia of cattle, okay? I will bring up that I've talked with veterinarians and livestock producers from other areas of the world that do not have access to firearms. And of course, me being me, I wanted to ask them, how do you euthanize animals if you don't have access to a firearm? What I heard was absolutely appalling. They would use blunt trauma with a hammer once that animal went completely down. That made me sick to my stomach. It really did. We are beyond that. We understand how we need to care for these animals, and that is not it. Okay? So firearm euthanasia is very appropriate for a lot of our especially for our cattle. We have rifles, shotguns, and pistols. Each of them have their either their positives and maybe a few setbacks, and we're going to talk about that. If you have hired people, if you have a feedlot or a growing operation, and you're the one supplying the firearm for euthanasia of that, you're training people, lock it up. Make sure you have a lockbox at the feedlot, okay? If you're the manager, making sure that you're keeping an eye on that. Even ammunition. I found out that, boy, sometimes a year, all of a sudden ammunition starts to go awry because it was easy access, and boy, it was gopher season, and they wanted to go shoot some gophers out in the pasture after work. And then when we needed it, guess what? Where's all our ammunition? Okay, so please lock it up. Make sure you keep the quality control just like any of our other equipment, making sure it stays up to spec. The second set of equipment that I'll talk a little bit about, these are very rare that we really don't use them in industry, but they're out there. And it's a approved method of euthanasia, so I will discuss it a little bit. Captive bolts, okay? Captive bolts, there's usually a couple different types. There's penetrating and non-penetrating. For the sake of this discussion, I'm just going to talk about penetrating. They can be pneumatic. They can actually use firearm blank shells with no projectile, just the powder charge. And what they do is they shoot a little metal rod down through the skull and then ejects back. That's what it is, okay? It's often been discussed as a stun gun, okay? Because it's a sudden loss of consciousness, but it doesn't directly kill the animal, okay? There needs to be a second stage of, a second step to actually dispatch that animal, okay? And that's one of the big distinctions between a stun gun or a captive bolt and a firearm euthanasia. And this is what some of those may look like. This is a cache kit. They have a number of different little twist-on barrels. But again, it's kind of built off a pistol frame. They use a small charge that looks similar to a bullet cartridge, but there's just no bullet, okay? Here's some other different types that are kind of screwed together that, again, use a small firearm charge to be able to push that rod in through the skull into the brain cavity and eject back. That's kind of how they use. Regardless of whether you're using a captive bolt or a firearm, they have to be functional, okay? So that's where, just like any other piece of equipment, making sure that we maintain and making sure that they actually work. We do need to clean them. We do need to upkeep them to make sure that if we do need them in that period of time, we know it's going to work. Here's one of the big updates. Okay, the Beef Quality Assurance, they did update their euthanasia guidelines on location of where we want the projectile to go, whether using a captive bolt or whether using a firearm. Okay, who remembers the old X's? Oh, where the horn base down to the outside of the eye, or was it the inside of the eye, or where does this X go? Well, we did away with the X's, okay? So no more X's when it comes down to a euthanasia location. They simplified it to this. If you draw a line just above the eyes and you draw a line at the pole, it's right in the middle. It's about as simple as it gets. A line above the eyes, a line at the pole, and directly in the middle. That is the preferred euthanasia location from a frontal shot for firearm and captive bolt euthanasia. That's what's changed. Okay, there was too much confusion on some of the other ones, and there's a good reason why they simplified this. Before I kind of show a cross-section so you can understand it anatomically, I do want to point out that our goal with a firearm euthanasia is to hit the brainstem of an animal. Okay, the brainstem is what controls the heart, breathing, blood going through the system, and it lies right at the base of the ears. So regardless of that placement, okay, above the eyes and right at the pole and in the middle, we need the projectile, the trajectory, to try to hit the base of the ears. The base of the ears of the animal is where that brainstem lives, and that's ultimately where we want that projectile to go, where we want the bullet to go, okay? What may surprise you is how high on the head we have that location of where we want entry point, okay? The reason it's so high on the head, this is a cow head that we actually split right down the center with a bandsaw. Okay, this is a part of a research project, but here's the nose down here at the bottom. This is the pole way up at the top of the head. Here's the brain cavity, okay? The brain sits very high in the bovine skeletal structure of the skull, okay? The steel is located directly in between the eyes. So just as a good visual assessment of where the brain sits in the head of a bovine, it's very high in the cranial cavity. Okay, and that's why the proper point for entry is above the eyes, at the top of the pole, and directly in the center. Okay, does that make sense? All right, whenever using firearms, I always have to pull in this plug because I'm talking about firearms on government property. I probably ought to talk about safety a little bit, right? Treating all firearms as if they're loaded, making sure that we know what is behind that animal whenever we have to utilize it. The other big one that I want to point out, if possible, to making sure the barrel doesn't explode, we never place a barrel directly up against the skull. Especially for a high-powered rifle, something along those lines that would build too high a pressure in the inside of the barrel and can explode. So I do want to point that out just to make sure. A lot of discussion happens on what type of caliber choice is appropriate for cattle and what size of cattle. And I want to try to simplify that for you today, and we can have a little discussion about that, okay? Handguns, rifles, shotguns. Handguns, we can have some powerful handguns that can get the job done. But guess what? They are for close quarters only. We don't have a whole lot of longevity to be able to use those. Rifles and shotguns do give us flexibility with distance, okay, within a reasonable period of time. Or a reasonable amount of space. In general, for feeder cattle, 450 pounds to 800 or so, they came up with this group of recommendations of ballistic energy. Each cartridge has a little bit different ballistic energy, and that just is going to quantify that bullet is going to puncture the skull and do the job that it's supposed to do. Okay? So they threw out these numbers at us, and they were published, about 350 foot-pounds of ballistic energy for feeder cattle, okay? Or 500 or more for mature animals. But what in the world does that mean? Well, let's simplify it a little bit better. For baby calves, and calves up to 450 pounds, we're really looking, yes, a 22 long rifle could be functional. That is the only place that you're going to see in the rest of this presentation that I have 22 long rifle. Baby calves. Anything larger than basically a baby calf, we do need a 22 Magnum or larger, okay, if you're going to be using a rifle. For pistol calibers, of course, 38 to 45 or more for mature bulls. Mature bulls are a little bit different ball game, right? They have a much thicker skull. Making sure that it actually punctures through that skull is very important. Buckshot or slugs, again, can be very practical in some of those situations. So yes, they are available and they can be used. I'm not going to go through all these, but just so you know, 22 long rifle isn't even on this chart because it doesn't even get up to 350 foot-pounds per second, foot-pounds of energy. 22 mag does, which is very comparable to a 9mm round. So a 22 mag and a 9mm basically have the same amount of energy. And when we go all the way up to a 12 gauge slug, it's almost 3,000 foot-pounds of energy. So that's the difference in some of our cartridges of what we have available to us. Now, some of you might be asking, well, Doc, I've been using a .22 long rifle. I've had that forever, and I've properly put it down. And I agree with you. You probably have been able to get that done. The next two pictures, these are CT scans. During a study when I was in graduate school here at K-State, we were actually trying to measure the effectiveness of euthanasia with different calibers. So we actually took heads, and we were able to use different calibers, and then we took them to radiology, which the radiologists loved us, taking, bleeding cow heads, rolling them through the vet hospital. But they obliged us, and we got it done. We put them into a CT scan where we can actually look on the inside of that animal's head to see what the damage was, and we can measure it. As you can see here, the top of this is the pole. This is the pole of the head. Here's the brain cavity. The brain stem is down here on the lower right. All of this bright white pieces, that's bullet, that's metal, okay? And this picture actually came from a .22 with a solid point bullet. That solid point punctured through the skull and broke up into a lot of pieces, caused collateral damage to the brain, just like we wanted it to. This is a .22 hollow point. Hollow points, they have the center hollowed out of the bullet itself. Once it hits the skull, what is it designed to do? Expand. Where do you see all the white specks on this picture? Stuck in the skull, okay? So that's a .22 hollow point, did not puncture the skull, and that would have been an inappropriate euthanasia. So I bring that up. .22 caliber, solid point is sufficient for baby calves. But past that, we do need to go to a higher caliber. .22 Magnum does have more powder and more energy. That would be acceptable, but never a hollow point, okay? And then what about our bulls? Where that skull that I just showed you with that, it's puncturing through about an inch of bone between the frontal sinus. What about a bull? Who's seen a bull skull before? There's a lot of bone on there, isn't there? Especially a mature animal. Mature cows have much more bone, and it's much more dense than young growing animals. So that's when we really need to consider much larger calibers. If it's a pistol caliber or even out of a Henry lever gun, a .357 can suffice. Or larger caliber rifles, even larger than a .22 Magnum. Now there's a couple other different types, and I want to talk about bullet type a little bit here. I mentioned that .22 Mag and 9mm rounds have the same amount of energy. Has anybody ever seen a .22 or a 9mm pistol round? Solid point. This skull was shot with a 9mm pistol round. What do you not see? Don't see any white specks of bullet that broke apart. It moved slow enough, and with its energy, it just poked right on through and kept on going without any collateral damage to the brain. All that was damaged was the pathway through. Okay, so it's something to consider. And then, of course, a 12-gauge slug. But, of course, we do need to be aware of pass-through. Pass-through is where danger can happen, okay, of other animals within a group, of employees a little bit further away that could have ricocheted and gone a quarter mile away. Okay, so we do need to be cognizant of that. I've got a few pictures and a few scenarios that I kind of go through. Not all animals that we need to euthanize are down flat or laying down like this, that we can approach all the way up to that animal. This isn't how every day always works, right? This was a situation, I actually took this picture. I was standing behind one of my foremen. His name was Moises. This animal had a broken leg. The left hind leg was broken, and we needed to euthanize it, and I was behind him. Soon after, as you can look at this animal, what do you think about its head? Think it's happy about the situation it's in right now? Not at all. About 2 seconds after I snapped this picture, the gun didn't go off, but the animal did, and actually ran us up over the fence, and we had to get away, or else they were going to take us. I bring that up because fractious animals that are severely in pain or have distress or have chronic disease can be unpredictable. Okay, so if you are using or have to get in close quarters with some of these animals, we need to have an escape route. Okay, our escape route was jumping over this handling area and getting out of the way. Also, some of these animals, they're prey species. They want to hide their disease, they want to hide what's going on, and they want to mix back into the herd so you don't see me, right? So we do need to take our time. Separating them by themselves sometimes amplifies the problem. So take your time, do it right, making sure those animals have enough space to feel comfortable where they actually turn and look at you. But what about this? We got the wild Mexican steer running about Mach 10, and it's got something that we actually do need to euthanize it. How do we take care of that situation? It's not the easiest. While these are never the first place that we have to, first placement that we would euthanize an animal, there are unique situations that make frontal shots inappropriate, okay, that we would have to do from a distance to knock the animal down to be able to do a proper euthanasia. Only under those circumstances would either a heart shot or a neck shot to be able to drop the animal to properly euthanize it be used. Okay, this is for unforeseen circumstances and kind of critical situations, not to be used every day. Now, I took this picture at my house. I was looking at some cows, and I'm like, you know what? I was like, if I had to euthanize this cow, what about her? Okay, what about her? We're always worried about employees and other things behind the animal that we're euthanizing, but other cows in the area could be in danger as well. Okay, so keep that in mind. Then captive bolts. Again, field situations, if we have that wild Mexican animal running all over creation or trying to run us up a fence, I'm not going to go and, if I run her into a hydraulic chute and euthanize her with a captive bolt, how do we get her out of the hydraulic chute? That's the question, okay? It's not very practical. I had a captive bolt when I was in practice. I actually had 2 of them. I never used it. There was never an opportunity that I felt comfortable enough to walk up to that animal to actually use it. So, again, we use the same placement. It shoots the little rod down through the skull, and that's how it works. And then IV injection, again, that's for your veterinarian. We can give barbiturate overdoses. But after we give a barbiturate, we have some severe questions that we don't know what to do with the carcass after we've given one of these barbiturate overdoses. Rendering won't pick it up. Certain digesters won't take it. There are some opportunities you can compost. There are concerns for wildlife. You know, these injectable products kill the animal, okay? So there is concern with that going back into the environment. So the use of these is becoming less and less and less for those very reasons. Regardless of how you euthanize an animal, okay? Firearm, euthanasia drugs, captive bolt, I do want to talk about the process. It's not the prettiest sight. It is very normal to see involuntary movement of that animal whenever it drops. Legs can fly, they can flop around. There may be a few agonal breaths that happen. It's not a pretty sight, okay? But it is something that is needed to do, and it is needs to be done correctly, okay? So we really shouldn't be doing this right along the county road where the bus stop is, okay? We need to be realistic about that, okay? And I bring that up as an example, but it's happened in some situations, okay? So we always have to keep public scrutiny in the back of our head on how we do things on our operations. How do we confirm that the deed was done correctly? And that's what I'll talk about now. The first and foremost, those animals, okay, they drop immediately, they roll over on their side, they have no righting reflex. They're not trying to roll over on their sternum at all, okay? They're on their side. There may be a few agonal breaths. An agonal breath is and maybe a second one, but it's not rhythmic. There is no rhythmic breathing, right? I have corneal reflex. Okay, corneal reflex, I'll go into it here for a second. This has to do with the eye. The first place I go to assess to make sure that everything went as planned is immediately they will scrunch their eyes closed. And after about a second and a half, the eyelid opens up, the eye comes back to center, the pupil gets really big. That's what should happen. Doing the corneal reflex is if you walk up and just slightly poke the inside of the eye on the eyeball itself, an animal with brain waves that are still working would blink. If there is no response and there is no blink, that has to do with brain destruction, okay? That's how we know that it was confirmed. Again, no rhythmic breathing, absence of vocalization, lack of heartbeat, okay? The heartbeat may pump for a short period of time, up to a couple minutes, okay, even after an animal that is brain dead, okay? But again, no attempt to right itself, and then rigor mortis, they go stiff, okay? That's when we know, absolutely, it takes a little bit of time, but that's when it undergoes. So here's an example of the corneal reflex. Again, the eye is wide open, the eye centered itself in the eye socket, the pupil, the black area, got really big. You go up and poke the side, there is no blinking. If you see this, that they immediately after they drop, they may squeeze their eye shut. I just want to make sure. But pretty quick, within a few seconds, it should open back up, okay, where you would be able to see this. And again, confirming, which may take a couple minutes for the heart to completely stop. Okay, what if there is a little bit of rhythmic breathing? Okay, what if there is some of those other signs or the eye is still closed? What do? If you're using a firearm, immediate follow-up second shot is warranted. Okay, immediate follow-up. That's not something we wait on. We do need to go and assess to make sure that it was done appropriately, to make sure that animal is unconscious and stays that way. So if it's a firearm, immediate second shot. If it's a captive bolt, we may have to utilize pithing or exsanguination. Bleeding is exsanguination. This is where we would actually slice through the throat. We would take a sharp knife, and I do say a sharp knife for a reason, but we would stick it just below the jaw line, below the spine. We stick it all the way in and cut out, where we have the opportunity to cut through the carotid artery, the jugular vein, and also part of the trachea in one clean swoop. And of course, all the blood would exit the animal at a pretty rapid rate if the heart's still pumping, and that would confirm the death. And then pithing is a little bit different. I'm sorry you guys can't see this, but I'll explain it. Pithing is a long metal rod, okay? A small kind of metal rod, could be made of plastic, but for use of a captive bolt, they would make the hole, the animal drops, but to confirm the death, at the secondary step would be taking this rod, placing it through the hole, and destroying the back of the brainstem with that metal rod, okay? You know, in the lab, we may use some secondary kill steps that are a little bit different. Rather than bleeding, we can use some potassium chloride and some other salt concentration products. But this is not acceptable to be used to actually euthanize the animal. Never. Only an animal that is already completely under anesthesia or already been euthanized with another means could these products be used. And just so you know, xylazine, Rompin, does not actually give, and it's not a true anesthetic. It's just makes them go to sleep a little bit, but they can always wake up from it, so that's not acceptable. And I'll just kind of finish up here. I think I've talked long enough. We can talk a little bit more, get us back on track a little bit. There are a few unacceptable means. Manually applied blunt trauma, that's never acceptable in the bovine species. When I found out that there are other areas of the world that don't have access to firearms, that's how they euthanize their animals, that is not acceptable. And it should never be acceptable for us. We are better than that. Any injection of unapproved chemicals or things like that, air into the vein, none of these things work or are practical, or electrocution. Okay, none of those are means that we can use in the cattle industry. So I hope you took a few tidbits. Maybe you're going to go home and reconsider what type of firearm cartridge you may use or bullet type that you may use if you have to euthanize an animal. These are not situations that we look forward to. Usually they are unique situations, whether we've had an animal in therapy or an accident occurred and an animal possibly broke a leg that we do need to put it down, that there's no point of recovery. Okay, but whenever we grab whatever method that we utilize, we need to make sure that it gets done correctly. So landmarks and trajectory, always keep that picture in the back of your head. Top of the eyes, top of the pole, right in the center. And where we want the trajectory to go is the base of the ears. Is everybody all right with that? Makes it a little bit more simple than a bunch of X's and things like that. Just top of the eyes, top of the pole, right in the middle, right? Confirmation, remember the corneal reflex, okay? Remember, no rhythmic breathing, right? They're not trying to right themselves. The eye comes back to the center and gets really big and dilated, okay? Those are all useful things to confirm death. So really that's all I had for you. Again, thank you for sticking around and listening to this. It's not a regular topic that we talk about all the time, but I do think it's important enough to discuss in an avenue like this. So thank you. Do we have any questions? I'd be more than happy to answer anything. I am going to be hanging around the rest of the day, so be happy to visit with you later on as well. But open the floor up for any questions you might have. Yeah, Ty. What's that? Ricochets?
Off the animal's skull. Is there any situations where that may happen?
Yeah, so the question was on ricochets, on what could possibly lead to ricochet. And yes, there are certain situations. We need to make sure we are perpendicular with that animal's head. Okay, the front of the skull is flat. Okay, and that flat skull is like shooting into a wall. Okay. Now this flatness of the head, if I was standing from this orientation, from where I'm standing right now, and I had to shoot that animal or move its head at the last second, we have a high likelihood of a ricochet off the skull itself with no penetration. Okay, so making sure that we are perpendicular to the head itself, that they aren't turning their head from one side to the other, or we're not trying to take a shot at a moving target, all of those things greatly increase the risk of having a ricochet. So, yes, sir. For the location of, yes, they are. So swine are a little bit higher. Sheep, their skull conformation's a little bit different, so you're a little bit higher on the head itself. But all of them are pretty. The brain does sit much higher, especially on our quadrupeds, than what we are, because we got the biggest brain, right? Hopefully most intelligent, but not always. Right? Dan, do you have anything to add? No. All right. All right, well, thank you, everybody, for your attention.